morning, everyone, and thanks for coming for this session on this Sunday morning. So, we're going to talk about importance and benefits of communication skills. So, the question is, why are we even talking about it? Let's look at some of the numbers. Medical errors are the third commonest cause of deaths in US. According to WHO, 25 lakhs deaths occur annually because of medical errors. Coming to India, there are a boggling 5 million medical errors which happen annually in India. Mind you, this is just the tip of the iceberg. There's hardly less than 10% of the medical errors are reported. So, communication skills or communication knowledge is not optional anymore because the patient is a consumer now and the consumer awareness is an all-time high. Demands and expectations are very high. Doctors are not put on pedestal any longer. We cannot have godlike complex any longer. There's lack of trust. Stress and aggression is so much in the people. You don't have to come to the hospital. You just have to walk on the Kochi roads or drive on the Cochin roads. They bring in all the stress to the hospital. Sorry. Social media, everything is streamed live, and we know how it incites violence. Again, some numbers for you. Approximately 70% of the legal claims for medical aid negligence happens because of communication breakdown or poor communication or miscommunication. I'm going to touch upon broader aspects, points here and there, and my esteemed colleagues will be talking about specific situations. Let's talk about OPD. Approximately how many or what time does a doctor take to interrupt a patient? Any guesses? 11 seconds. That's all it takes for us to interrupt the patient. And if we do not interrupt, or if we let the patient continue with their stories, approximately what time do they take to tell us? 80 seconds. This is on an average. There are, of course, exceptions, but we have been always taught to ask leading questions. We keep on interrupting. Why are we talking about this? I know exactly how you feel. Empathy, empathy, empathy. This has to be the mainstay of all our communications. And the communication doesn't start at the doctor's cabin. It starts at the gate, at the security post, then at the front desk, then doctor, nurses, lab technicians, pharmacists, and this is all healthcare communication. It's not just the communication between the two, doctor or patient. Communication should be there at all levels and it should be done properly. I draw your attention upon this. What do you understand? This is exactly how the patient feels when we talk in medical jargons. We talk about, capsular distension and pseudo-exfoliation and all that, and, nothing is understood. And at the end of the day, we are wondering, we told the patient everything. And how come? Even then they are asking us. There's a huge gap between what we believe has been communicated and what actually the patient has perceived. There's been studies which show that 75% of the orthopedic surgeons believe that they have communicated properly to the patient, whereas in reality, only 21% of the patient express satisfaction. Look at the number, 75% and where's 20%? That is the gap. Most of the medical litigations are due to miscommunications or poor communication. This picture says it all. We are talking something and the patient, gets into something else. It's not just what we talk, it's also how we talk. Only 10% of the conflicts are due to wrong words. 90% are due to the wrong tone. So how we communicate is also equally important. It's not just what we communicate. This is called paralanguage. The pitch, the volume, the rate. Are we going too fast? the quality. Are we shouting hoarse, talking softly? The intonation. Intonation is nothing but the voice modulations. All these are very important. And why do we need effective patient communications? It's not just improved patient compliance, leading to the better outcome. Leading to the better outcome, not just for the patients, even for the doctor, and also for the institution. How come better outcomes for institutions? Everybody is communicating in a proper way, in a good manner. Then there is good work environment. There's enhanced safety for doctors and all other healthcare professionals. Greater job satisfaction. And patient scores. We know that the Google reviews matter so much nowadays. What is the golden rule of etiquette? Do not do to others what you would not wish done to you. This is extremely important. Let's all remember this. So take home messages. Communication skills are not just about niceties or soft skill anymore. The therapeutic communication happens between healthcare provider and the patient. Clinical communication among healthcare providers. That's what I talked to you about. And this has got direct impact on patient safety, satisfaction, and the treatment outcomes. There's a need for medical auditing, even if it is a very small institution. Medical auditing is a must. Thank you so much.
Thank you, Dr. Suchitra. That was a wonderful and actually a very lucid and, we had a lot of take-home points in this. And because communication per se is a very large subject, it is very important to, listen to the same thing probably again and again in different languages, which is what this IC essentially is about. So now we have